Ed O'Keefe is a congressional reporter for The Washington Post, and he joins us now from the Russell Rotunda on Capitol Hill. Good to talk to you, Ed. Thanks so much, and what a busy day on Capitol Hill. First of all, your reaction, were you surprised that this vote was delayed today?
Well, look, there were a few possibilities of what could happen here, and the biggest one was to just delay a vote or essentially pull it. Or officially, it isn't even up for debate just yet, and that was the issue. He couldn't find enough support among his own Republicans, Mitch McConnell couldn't, to bring this bill up and begin formal debate. And in the hours since he announced this, already another 3 at least have said that they couldn't support it as written right now. Rob Portman of Ohio, Shelley Moore Capito of West Virginia, and Jerry Moran of Kansas. That's a surprising one because he's usually in lockstep with Republican leadership, but now several making it clear that as written right now, they cannot accept it. So that means it's going to be at least another week and a half of rewriting and negotiating and cajoling, and probably a lot more involvement now from the White House in getting enough Republicans to move forward with this legislation. McConnell told us a little while ago, where you were just playing his comments, that he thinks it's now important and helpful for the president to become engaged, saying that earlier on it wasn't necessarily a good use of his time to be involved in the bill writing, but now that the general principles are out there, McConnell said he expects the president will play a much larger role. The vice president, Mike Pence, also getting involved by hosting a collection of more conservative senators tonight at his residence here in Washington to talk about the details. The risk, though, for Republicans is that over the next week and a half, especially next week when they're home for the July 4th holiday, marching in parades or meeting with constituents at other events, that they're going to hear it from constituents, and there may be enough of them that just feel the political heat too much to the point where they come back and yet again say, I still can't play ball on this. We've got to make some more fundamental changes or find ways to work with Democrats to keep the current structure and just, fix some of the bigger concerns like the cost of premiums and who exactly gets covered by what. And yes, a very Republican concern, that is the fate and the future of Medicaid.
You mentioned the White House, Ed, and we heard from Sarah Sanders, the deputy press secretary, who was asked, of course, about the delay in this Senate vote just a little while ago during the White House press briefing. Let's take a listen to what she had to say.
We're continuing to be optimistic. The president is committed, as he said, and all the members of the administration have said repeatedly, to repealing and replacing Obamacare, working with the Senate, working with the House, making sure we get the best bill. For us, it's never been about the timeline, but about getting the best piece of legislation that helps the most Americans.
So it's never been about the timeline, Ed, even though this is a president who said he was going to repeal and replace Obamacare on day one. But here we are, and I just wonder, what can the White House propose? What ideas might the president and the vice president have that somebody hasn't already thought of that could bring both moderates and conservatives on board and get to that magic number that the Republicans need, which is 50?
I don't know that they're going to propose anything new, Rick, but they may now be hearing from senators about more specific concerns or ideas from them about how exactly this should be changed. And by them hearing it, they may be able to work with McConnell to work out a plan and do the math and figure out how do we get at least 50 of the 52 Republican senators to agree to something. What's the right balance? What deals with the structure and the size and the future of Medicaid on one end, provides enough money for opioid addiction issues and programs across the country, make sure that every state is treated fairly, maybe even finds a bigger way to bring down the number of people who are set to lose insurance. And it's just going to require listening and figuring that out. But you're right, they may not find anything new. They may be in exactly the same spot 2 weeks from now when they get back, and that's the risk, is that this will just drag out, delay things further, be playing out in public, and allow critics of the legislation to just hammer Republicans in the White House for continuing to threaten to make these changes. And so there's a big political risk here in allowing this to fester longer. And for the White House and McConnell to say that timing hasn't been an issue, well, that's a few cents short of the truth, frankly, Rick, because they have been saying they needed to get this done ideally before the July 4th recess so that they could come back through the rest of July, work on raising the debt limit. They've got to work on a budget. They've got to work on reauthorizing a host of federal programs like the flood insurance program and other things of that nature. The FAA needs to be reauthorized. These are tricky, not very popular or well-publicized items that Congress just has to do. And if you can't be doing this big one, how on earth are you going to be able to do the other one? And all that other stuff requires cooperation from Democrats. If you're upsetting them by continuing this debate and keeping them out of it, one wonders what, if any, kind of bipartisan progress is there going to be in the next few months when they start tackling all those other issues.
And we heard from Chuck Schumer earlier today and the Democratic leaders, Ed, who said, you know, look, we've got 3 conditions. We'll come to the table. We'll talk to you about health care, but here's what we need you to do. We want you to stop talking about repealing Obamacare. We want you to stop talking about cuts to Medicaid. And we want you to stop talking about tax cuts for the wealthiest. I mean, is there any chance that the Republicans might hear Senator Schumer and what he had to say? Well, say, okay, you know what? Let's take those things off the table.
Mathematically right now, there are enough Republicans working with Democrats on legislation that's written by members of both parties on specific aspects of current health care law. So yeah, conceivably, if it fails, there are enough Republicans right now who could say, look, I'm working on this, and these guys over here are working on this other stuff, and that is the kind of more modest, specific kind of tweaks we can make to current health care law that could pass at least the Senate. And in many cases, this legislation has companion members of the House who sponsor it. You know, it's things like lowering prescription drug prices by dealing with the possibility of bringing in drugs from Canada. It's figuring out ways to make it easier for you to get prescriptions or checkups over your phone and making sure that that is covered by health insurance. It is making changes to Medicaid and finding ways to bring down the premiums. Democrats want to do a lot of that. They just don't want to do it the way that Republicans are doing it, which is far more extreme, and they believe, many of them say up here, they use the word immoral, but by every measure, there are options on the table to bring the 2 parties together and start working on some specific changes that would meet Leader Schumer's requests.
Wow, wouldn't that be something? And Ed, as you and I talk, bus is full with senators. Republican senators have pulled up at the White House. We know that all of the GOP senators have been invited to the White House to talk with President Trump today, and they have arrived, and they're waiting for that meeting. Of course, we'll be reporting on what comes out of that meeting later on here on CBSN. But for now, Ed OKeefe of the Washington Post.
To be on that bus.
Love to be on the bus.
Take care.
Thanks so much, Ed.
Yeah.